3 people have been evacuated from the cruise ship hit with a deadly hantavirus outbreak as the vessel now heads to Spain's Canary Islands, where the remaining passengers will disembark and be evaluated for illness. MSNOW's Britt Miller has more.
As the number of hantavirus cases aboard the MV Hondias cruise ship continues to grow, so does global concern. And now another passenger is opening up about the deadly outbreak at sea.
It turns out the situation was much worse than we were told. And after a third person died, it became clear that there was Hantavirus on board.
The World Health Organization reports 3 people have died, including a Dutch couple. The total number of cases has risen to 8, with 3 confirmed and 5 suspected. And in the last 48 hours, 3 passengers were flown to the Netherlands for treatment, though there is no approved cure or vaccine to treat this virus.
What now is going on is international contact tracing. We have been taking samples of the clinical patients on board, and they're being analyzed right now.
The WHO confirms the hantavirus variant that spread on board is called the Andes strain. The virus is rare and can be transmitted between humans, though it originates in rodents.
So our working hypothesis is that there's different types of transmission happening. Clearly, we've had some kind of rodent exposure, whether that took place before the people got on board. We did ask if there were rodents on the ship.
Argentine officials believe the couple may have picked up the virus while bird watching before the trip began. They say they visited a landfill during that tour, possibly coming into contact with rodents. A Spanish newspaper reports more than 20 people disembarked on the British territory of St. Helena Island, including Ruhi Chenet.
I got off the ship on day 24.
That means they've been on land for several days. But Dr. Anne Ramoyne says symptoms may not develop for 6 to 8 weeks.
You have people spread all over the world who have a potential exposure, and that's complicated. And it means that there needs to be a lot of coordination and collaboration between countries and organizations.
After St. Helena, the ship was headed to Cape Verde off the coast of West Africa, but wasn't allowed to dock. Now the remaining 144 passengers are headed north to Spain's Canary Islands under protest from the island's leadership. The trip is expected to take 3 to 4 days. Dr. Ramoyne warns the fallout could look familiar.
An infection anywhere is potentially an infection everywhere. And if you don't have those safeguards in place and good disease surveillance, good coordination between countries, we're destined to repeat the same mistakes that we've made in the past.
And she says the hantavirus is unlike COVID because it doesn't seem to spread with the same casual contact. But she also mentions the investigations and the observations over the next several days will be critical in stopping this.